A.Q. Chuk from the public health field on the topic segregation practiced by health workers in urban hospitals, a step necessary to achieve minimization and effective biomedical waste management. I welcome Edith for present this paper in front of you all.
The title of my presentation is Segregation Practices by Health Workers in Urban Hospitals, a step necessary to achieve minimization and effective biomedical waste management. Introduction. Biomedical waste have been defined as a special type of waste generated during the activities of treatment, diagnosis, immunization, observation, and also during other biological and medical activities. WHO 2005 and WHO 2014 stated that out of the total hospital waste stream, about 20 to 15% of the biomedical waste are infectious, while 80 to 85% are non-infectious. The waste were further categorized to enable easy identification by sorting into color code liners. WHO further categorized this health waste into 5 categories, namely the non-risk waste, the high risk waste that deserve or that should be given special treatment. Also, another category C, where the highly infectious waste. Another category where the hazardous waste and radioactive waste. Segregation is an important process in achieving proper health care waste management, which involves the isolation of biomedical waste from the entire hospital waste stream. Segregation practice is essential in achieving the reduction of the portion of hazardous waste and achieving effective management of biomedical waste and identification of this medical waste, according to WHO 2005 and RADA 2009. The health workers have been known to be the generators of this hospital waste and are obliged to adequately manage this waste from the source of generation to the final disposal. According to WHO 2002, reported that, or recommended that segregation should be safe, simple, understood, and regularly monitored to check compliance. The problems are stated. When segregation practices are unsatisfactory at the health facilities, this implies an incorrect estimate of various categories of waste. The health sector is poorly funded, and so the biomedical waste management has not actually received the priority that it deserves. According to Edith et al. 2013, there is lack of enlightenment and sensitization on proper handling practices and hazards associated with improper biomedical waste management, according to Awodele et al. 2016 and Omokele et al. 2021. There is laxity in the compliance and adherence to the international guidelines on biomedical waste management, according to Anozie et al. 2017 and Oli et al. 2016. There is few literatures on segregation practices in healthcare facilities in Nigeria, Akingbeyi et al. 2019 and Omokele et al. 2021. Method. The study was a cross-sectional observational study. The study was carried out in Abuja, which is the administrative and political seat of Nigeria. Cochrane formula was adopted for this study, where the population was infinite. An average of 12% was added to the sample size to account for non-response, late response, and incomplete response. The inclusion criteria were clinical staff must have worked for a minimum of 1 year, agreed to participate, and signed consent form, and not a participant in the pilot study. The exclusion criteria were not a clinical staff, must have worked for less than a year, participated in the pilot study, declined to participate, and did not sign consent form. The simple random sampling technique was employed for the study. Pre-tested structure self-administered and self-completed questionnaire were used for the data collection. Ethical approval was obtained from the National Health Research Ethical Committee of Nigeria with the approved number. Measures. The confidentiality of the participants was assured, and also the confidentiality of the hospitals was also ensured. Respondents were free to withdraw without consequences. The purpose of the study and the questionnaires were explained clearly to the respondents. Respondents picked the best options based on their experience and understanding. Also, cultural validity was ensured, content validity was ensured, and control of social responses bias was also done. The items were responded to on a Likert scale of 1 to 5 scale. Data analysis. The ordinal scale were converted to interval data and captured on Excel template. The data collected were coded and entered in the SPSS version 20 software for analysis. Entries were checked for accuracy. Descriptive and reliability analysis conducted. The chi-square statistic was conducted to determine the level of determination set at p less than or equal to 0.05. Results and discussion. Descriptive statistics. Predominantly from the public, most of the respondents were predominantly from the public hospitals, and most of the respondents had worked for over 15 years, and the majority of the respondents were nurses. Most of the respondents had a bachelor's degree as their highest educational qualification. The mean was between 3.105 to 4.603, and the standard deviation as stated. The reliability analysis was also carried out, and the compass alpha was equal to 0.830 and factor loading between 0.601 and 0.949 for the segregation processes. And this shows that the measuring tool was actually reliable, and the items on the measuring tool were correlated and consistent. The chi-square test revealed an association between practice of handling biomedical waste and biomedical waste management, P set at less than or equal to 0.05. Here are the results. Table 1 shows the segregation of biomedical waste at different locations. Here we find out that majority of the respondents agreed to segregation at the source of generation. Table 2 shows colors of the container and liners for efficient segregation of biomedical waste. Yes, the respondents also, most of the respondents were agreed and showed that they knew the appropriate color coding system for carrying out segregation. Here is that the study was also carried out, observations were also carried out in the study. And so in some of the hospitals, we observed actually that they had these color coding containers and liners for appropriate segregation practices. Discussion. The respondent demonstrated understanding and practice segregation using colored bins and safety boxes for sharps. This finding agrees with the work of Awodele et al. 2016 and Dunloye et al. 2018 in Lagos and Abuja. But the findings of this study did not agree with the previous work of Abor 2007, Oladiza et al. 2015 in Jos, Kiriza et al. 2019, Akigbenyi et al. 2019 in Lagos, Adu et al. 2020, and Omokele et al. 2020, where segregation was not practiced satisfactorily. The respondents supported segregation at the source of generation, and this agrees with the previous study of Awodele et al. 2016, but differed with Sahi Pro and Mostaferi 2009. The results also show that the respondents were able to segregate shafts into safety boxes, and this was in agreement with the previous report of Awodele et al. 2016 and Akingbenyi et al. 2019. Also, the results show that the respondents were aware of the color coding segregation. This finding is in agreement with Abdullah et al. 2013 and Awodele et al. 2016 in Lagos, but differed with the previous report of Akingbenyi et al. 2019. Color coding has proven to be efficient in hospital waste management, according to Chisholm et al. 2021. The use of instructive posters, appropriate labelings, and color code is necessary to achieve effective segregation, according to Abba and Ohimen 11. These are a cross-section of the references. We're instructed to just write about 5 of the references. Conclusion. The study showed that the health workers were agreed to the segregation practice as part of the standard operating procedures. The respondent practiced segregation from the source of generation using color-coded receptacles as stipulated by WHO. It also shows that the respondent also understood the need for the effective segregation practices in ensuring effective waste management. Conclusion and future steps. Future step, periodic surveys for feedback and evaluations towards understanding the issues and develop a sustainable waste management minimization framework. Secondly, investigation on categorization and quantification of biomedical waste at various levels will provide useful information for planning, budgeting, and policy making to achieve a cost-effective biomedical waste management. Recommendations. Health managers should ensure monitoring, implementation, and enforcement of segregation practices, especially using color-coded bins. Health managers should ensure adequate supplies of materials for segregation. Health managers should enlighten and sensitize the health workers and the public on proper biomedical waste handling practices. The health manager should ensure enforcement and adherence to the use of guidelines, appropriate labels like the biohazard symbols and posters. Thank you.
Thank you, Ms. Edith, for your presentation. Hi, attendees. We are enabling poll session for Ms. Edith. Also, you can post your questions in chat box where Edith can present on that. Okay. Ms. Edith, we have one question like, how did you ensure construct validity?
Okay, I ensured construct validity based on existing body of knowledge and empirical studies.
Thank you, Edith. We have one more question from Samsudin. What are the possible limitations to this research?
The possible limitations were time and the cost to carry out the study. The type of the structured questionnaire itself was also a limitation, and then the study was carried out in a limited geographical area, which was not a true representative of the national outlook.
Okay.
And also the study was also observational, so some of these findings may change over time. Also, the late responses, the non-responses were also limitations to this study.
Thank you, Edith. We have one more question for you. What is your take on outsourcing the bed lining washing in the biomedical waste?
Okay, I think that would be a welcome development where the hospital managers will contract such services to private companies to do the washings and treatment of those wastes.
Thank you for your answers. You can post your email over chat where attendees can inquire about the questions if they have anything. Thank you, Edith.